Hello there. It's lovely to see you both. I'm delighted to be joined by Michelle Conway, as always, who is our policy advisor and project manager here at RDNN. And we've been joined today by the lovely Holly Walton, Dr. Holly Walton, who is a research fellow at University College London in, Holly, tell me again, applied.
The Department of Applied Health Research.
Department of Applied Health Research. Holly, thank you so much for joining us. And we're going to have a quick chat today about what you've done so far and your thoughts and perspectives on care coordination in rare diseases. So, Holly, first of all, tell us a little bit about yourself. What do you do?
Thank you so much. So I am a research fellow in the Department of Applied Health Research. And for the last few years, I've been working on the CONCORD study, which is Coordinated Care of Rare Diseases, which is a project led by Professor Steve Morris, who's at the University of Cambridge. And this was an NIHR Health Services and Delivery Research Programme funded study. And there was a large team of individuals working on the project from a range of different organisations. So shall I give you a bit of information about the study? Is that helpful?
That would be fantastic. Just a little potted history would be brilliant.
Yeah, so the CONCORD project was a mixed methods project, which means that we used quantitative and qualitative research methods. So things like surveys, but also things like interviews and focus groups where we speak to people to get their views. And we aim to investigate whether and how care services for people with rare conditions are coordinated in the UK, and how patients and their families and also healthcare professionals would like them to be coordinated.
That's brilliant, Holly. Thank you. And we were going to, well, first off, what were some of the findings from the CONCORD study?
Yeah, so it was quite a large study. So we had lots of different aspects to the study. So there was a qualitative interview study conducted by Dr. Amy Simpson from Genetic Alliance UK, which looked at the impact of care coordination or lack of care coordination on people with rare conditions and their families. And it found that there were lots of potential consequences of lack of coordination, both financial, emotional, psychological, and social. So that was kind of the starting point. And then there was also a scoping review conducted, which basically means that we looked at the literature to see what was out there. And we did this for chronic conditions more generally, because there wasn't a lot of research into rare conditions at the time. So we thought we wanted to learn about what care coordination meant from the chronic disease literature to see if we could then apply it to rare conditions. So what we did was we did this review of over 150 review papers, so it's a very large study. And we also held some focus groups with people living with rare conditions, their family members, and healthcare professionals. And from this, we were able to define care coordination for rare conditions. So I just found the definition so I can tell you what that was. So we defined care coordination as everyone involved in someone's care working together to achieve shared outcomes. And it should be throughout a person's whole life, should consider the whole person, be family-centred, evidence-based, and equitable for all. So regardless of condition or location, for example. So that was kind of the starting point, and we found lots of different components of care coordination, which I won't go into just now because there's many of them. But it basically helped us to realise that the definition and components of care coordination for chronic conditions does apply for rare conditions. But there are some additional challenges for people with rare conditions due to obviously the small numbers, difficulties diagnosing rare conditions. And we identified some additional components that were relevant. So that was kind of the starting point of the study. And then there was a huge survey led by Professor Steve Morris and Emma Hudson into how care is coordinated in the UK. And I won't go into that in too much detail today, because obviously that's not the bit I know the most about. But they had lots of interesting findings about how care is coordinated in the UK, or the missing pieces of care coordination in the UK. And then we also did a large piece of qualitative work, which, as I mentioned, is speaking with people to find out what's happening. So we spoke with patients, carers, healthcare professionals, commissioners, and charity representatives to find out the different ways of coordinating care. And also people's preferences for different types of care coordination, the benefits and challenges, the factors influencing care coordination, and the things that help and get in the way of care coordination. So it was quite a large study. And what we were able to do is we were able to develop it's called a taxonomy in the scientific terms, but it's basically a table which outlines lots of different ways of coordinating care. So we were able to sort of identify different aspects of care coordination. So how care coordination is organised, how teams are organised who work together to coordinate care, the different responsibilities involved in coordinating care, the access to records and how much access people have, frequency of appointments and care coordination appointments, and the type of appointments or care coordination, so the mode, so things like digital sharing or digital appointments, which is quite current at the moment given what's happened with COVID, face-to-face appointments, telephone appointments, so and things like digital records. So what we were able to do from this is kind of come up with some findings relating to which aspects of care coordination might work in different situations. And from this, we developed some hypothetical models of care coordination. So they're not real world examples because there were so many aspects of care coordination, it was very difficult to find them all in one place. But what we were able to do is kind of come up with a flowchart that outlines things that could potentially be considered, and develop some hypothetical models from that, which can then be used to kind of think about what do we need in each situation, what are the aspects then that we can tailor to each individual, because there's loads of patient factors, there's loads of healthcare professional factors, resource factors, society factors such as availability of guidelines that should be considered. So it is quite a complicated picture, care coordination, but we've tried to kind of, I think the study has tried to sort of show what's happening and kind of start to unpick it so that we can then move forward and think about how do we evaluate what's happening on the ground in future, and how do we improve care coordination for everyone living with rare conditions. Sorry, I've just waffled on for a long time then.
So Holly, I was just going to ask, I mean, I think you've probably already covered a lot of this, and clearly care coordination in rare diseases is a complex area to deal with. I guess if we just think about taking it a step back before actually getting the study off the ground, what was it that made you and the team feel that care coordination was important as an area to research more? I mean, I think we can kind of glean from a lot of what you've said that there is clear challenge there around delivering it, but was there anything in particular that drove the team to want to research this further?
Yeah, so I actually wasn't there in the initial stages because I was hired for the project, but just to reflect on what I know about the early stages and kind of the reasons for why we did the study as well. So I believe it was a conversation between Genetic Alliance UK and academics such as Professor Steve Morris, who kind of identified this gap in the research and realised that there wasn't an awful lot happening in terms of care coordination for rare conditions in the academic literature. And obviously there was the on-ground issue of the fact that lots and lots of patients and carers who are living with these rare conditions actually find it very difficult to access treatment. And it's particularly difficult for them because their conditions often affect multiple body systems across physical, mental health, and they require care from so many different sectors, so many different healthcare professionals, and it's a real problem in that they are ending up sort of travelling long distances to see different professionals in different places on different days. And so this had been highlighted as a policy priority many years ago. And I think that this kind of led the drive for the research team and all of our partners to kind of put together this application and do the CONCORD research. And kind of the drive is that if we can find out how to improve care coordination, then we might be able to start to reduce some of these negative impacts. So the things that Dr. Amy Simpson found in her research that she led on the impacts of care coordination. And because it's such a priority, we need to first know what it is and what's actually happening in the UK for us to then start to build on that evidence to say, what should we do about it? So that was kind of, I think, the main driver behind the research. And Steve would probably be able to sort of go into more depth about it. But I think that's kind of where it was up to, and the kind of real need to improve care coordination and make sure that we understand what it is and what's happening in the UK at the moment, and so that we can help to improve it.
Holly, you've almost created a monster here in terms of care coordination, because there's not a presentation, a webinar, or a conversation that I have in the rare disease world now that doesn't include those words, care coordination. Where do you plan to go from here? So the CONCORD study has been finished. You've established that there is a need for care coordination. Where do you go from here?
Yes, that's a really good question. And I think you're right. It's an area that we still have yet to find out much more about, which is always the case with research, isn't it? It's kind of it always leads to the next questions. So the CONCORD study has finished. So the final report obviously will be coming out very soon of the CONCORD study, and the papers are kind of coming out as we speak, which is great. But in terms of next steps, there's a keen interest from the team still to kind of drive it forward with more research. So the team are sort of applying for funding to do more research. And I think the key sort of priorities for the research team moving forward are as I mentioned earlier, the kind of evaluation on the ground. So how effective are these care coordination strategies that are happening? What is the cost of these care coordination strategies? Because we know that there's lots of different types of care coordination happening from our research that we've just done. But we don't necessarily yet know the sort of full ins and outs of whether they work, how they work in comparison to other aspects of care coordination or no care coordination. I mean, we can assume it's a good thing, but we need that evidence in order to say that it works. And in terms of the cost of it, we need to know whether it's cost effective and things like that. So Professor Steve Morris is a health economist, so that's a particular interest of his. And then in terms of my interests, I'm very keen to also secure some funding to work on a measure of care coordination for rare conditions in the near future. So thinking about how do we capture what's happening on the ground, which can obviously help with things like finding out if it's effective, because unless we know what's happening, we can't necessarily tell if it's working. So that's kind of our sort of next steps, I guess.
Vision.
The vision, but there's still lots to be done, and I'm sure there's still lots to be done in certain conditions and certain locations in the UK. And I'm sure, it'll be interesting to see what happens with the research findings that we have when they're sort of published, because I think people will start to have a look and think about how they can use them and where do we go from there, sort of thing. So
absolutely,
it's quite exciting.
I think you made a really good point about the fact that the policymakers want to know that something is working, and they want to know that they're getting value for money, and particularly with reference to the tool that you were hoping to develop. Is that something that you can foresee? And I know we did originally discuss it, working with RDNN on how to implement that tool. Where do you see that going, and what were your thoughts?
Yeah, so I think it's quite exciting. I think if and when we can get funding to do the care coordination measure, I think obviously the natural step will be to develop the measure and then use it in different situations to find out how successfully it can measure things to do with care coordination. So, for example, care coordinators and their roles, which I know the Rare Disease Nurse Network are very interested in, and kind of also to maybe compare different models of care coordinators or care coordination more generally as well, because we found there's lots of different types of care coordinator in our sort of CONCORD study, or there's lots of scope for different types of care coordinator, whether it being administrative, the sort of more usually perceived care coordinator role, where they're sort of involved in the sort of everyday care of the patients, and then some more sort of specialised clinical care coordinator roles. And I think there's obviously lots of scope for variation in modes, so whether they're delivered digitally or in person. So there's lots of opportunity, and there's lots of opportunity for variation in practice as well. So, which is it's not a bad thing, it's a good thing, but it's really important for us to be able to measure that. So that's kind of my personal aspiration, I suppose, in the future, to sort of secure funding to start unpicking that and whether we can actually measure care coordination. Because it is going to be a difficult thing to do, I think, but it's a worthwhile thing to do if we can achieve it. So yeah, that's kind of, let's see what happens, but it's quite exciting prospect, I think.
Brilliant.
So we've only got 3 minutes left, Holly, in this. So let's try and end by, what challenges do you foresee in trying to implement these measures, these care coordination measures?
Yeah, I think, well, securing funding is obviously the first challenge.
The big one, absolutely.
To develop the measure and to get it in practice. And I think there's also going to be challenges around making sure that the measure works, because obviously we've seen that care coordination is multifaceted. It has lots of different sides to it, lots of different aspects to it. And we're going to have to be, if we manage to develop a measure, it's going to have to be very, very specific in what it's kind of measuring. So we're going to have to really capture the elements of care coordination in a way that can be measured, but a way that can be measured easily by lots of different people. So researchers, professionals in their practice, obviously they might not have very much time to complete something like this, and even the patients and carers, like, it needs to be easily accessible for them to be able to complete, to say what their care coordination looks like in practice. So there's lots of challenges to overcome with the measure particularly, and I think more broadly with care coordination, the findings from CONCORD have kind of indicated that there's so much variation, which is fantastic, but there's also so much scope for potential improvements in care coordination.
Absolutely.
But then I think broadly we know that there's so many rare conditions, there's so many different conditions in different places. We can't necessarily have specialist centres for all conditions. So I think there's lots of challenges to be overcome in terms of thinking potentially in unique ways and making sure that everyone knows their role within care coordination in future. So do we have clear sort of responsibilities outlined between the many different professionals involved in care coordination of patients' condition, and how do we do it in an easy way that means people are not having more burden related to care coordination? So there's lots of research questions still yet to be answered. So there's lots of challenges to overcome, but I think, I think it's promising that there's lots of focus on care coordination and that there's a real drive for it at the moment. So
Holly, that's absolutely brilliant. I mean, clearly a mountain of work still to be done on care coordination in rare disease, but a huge amount of work has already been achieved, and you should be so proud and pleased of the work that's done so far. So thank you so much to you, Holly. We really, really appreciate the time that you've spent with us today. It's been lovely to talk to you, and come back once we know where you're going, once you know where you're going next, and come back and tell us about it. So thank you so much.
Thank you so much, and I will do.
Thank you so much, Holly.
No, thank you all.
Fabulous. There we go. Holly, you are a star.